Hey, everybody, and welcome to our inaugural first episode of Rewired, which is a podcast put on by the Neural Connection Clinic in Edina, Minnesota. We're excited to be here, and I know for those of you who are watching and listening, like you've either never heard of us before or you have, but you have no idea what the podcast is about. So this podcast is essentially everything that we wanted to offer to our patients, future patients, and people who are just looking for general information about taking care of your brain, your body, and helping you just live the life that you want to live. So this first episode today is just all about who we are as providers. We'll talk about our clinic, what makes us different, and why we do what we do. And so I'll just start for introductions. My name is Dr. Eric Reese. I'm a chiropractic neurologist at the Neural Connection. And one of the reasons why I got involved in this space was I essentially became a patient first and then a doctor second. And now here we are being educators and advocates third. So I love what we get to do because seeing people change in front of your eyes and seeing them change over days, weeks, months, and sometimes years is such a great, rewarding feeling. And there's just no better feeling than giving somebody their life back. So throughout this journey, I've got to meet amazing people like the gentleman to my right here, Dr. Thompson Mayasaka. Without further ado, Thompson, why don't you go ahead and introduce yourself to everybody listening?
Yeah, nice to meet all of the listeners virtually here. My name is Dr. Thompson Mayasaka, co-owner at the Neural Connection as well. And I'm sure you'll pick up on it as we go with some of these episodes. But Dr. Reese and I are strikingly similar in almost every way. Went to the same school, we went to the same doctoral program. We're both musicians. Like, it's just shockingly similar. And we also have a very similar background as to why we got into this. I think neuroscience for the both of us is one of those topics that we just never get tired of learning about. I think that's a big pull as to why both of us started to learn this, is it was that one subject in school when we could just sit down and read it, and 7 hours later you're like, okay, I have to force myself to go to bed. So we just love learning about this stuff, and we hope that comes across, and we hope that little tidbits of information that we've accumulated over the years will help you. That's really the focus of this podcast, is to take all of our clinical knowledge and take all of this nerdy enthusiasm that both of us have for this topic and condense it into little bite-sized tips each time that you can take and use. So try not to get super far into the weeds. Every once in a while, we might go full nerd on you. And for that, we apologize to most of you. Some of you are probably into that. So yeah, we're excited to bring this to you. We're really excited to share this information that we've accumulated through clinical practice, and we hope you enjoy it. We hope you find it useful.
Yeah, Thompson, you said something there that I think is super important, is not only are we passionate about this topic, but we've also brought a ton of experience and knowledge to the table, right? So, collectively together for our clinic, we've got some like 25 plus years of experience. And with that has come, learning so many lessons that I never thought I knew I needed to learn, learning lessons that I thought I already knew, but I didn't. And I really feel as though that patients teach us so much more than we teach them. And even with us being really focused and upfront on patient education, I feel like this is something that we continue to learn over and over again, is like what makes people tick, how we to get them better, what we've tried in the past that has worked, or maybe it doesn't work anymore. So there's just this continuous game of evolution and learning. And there's a reason they always call it practice, is that I genuinely feel the longer we are, seeing patients, the more practice it takes to continue to get better. And so with that said, I think you've taught me so much over the years, especially like in the headache and the migraine space. It would be great to learn a little bit more about like what drives you on that front, and any interesting things that you kind of brought to the table for the clinic that you really feel as though has made a pretty big difference in the outcomes for your patients.
Yeah, totally. My story of how I got into migraines is actually kind of embarrassing. I thought my whole life, what everyone thinks, well, most people think, is we all get headaches, and everyone's headache has the potential to cross this imaginary line that produces nausea and light sensitivity. And if it crosses that line, that's not just head pain anymore, it's a migraine. And that is incredibly frustrating. Infuriating, in fact, to the entire migraine world, because that's such a mischaracterization of a much larger, more complex issue. I understand that now. It was not until the very beginning of graduate school where we started learning about migraines, and then I got curious and started looking under the hood and really digging into what it is, and realized, my God, one, fascinating, incredibly complex, fascinating phenomena that I cannot get enough of learning about. It's just so much more than a headache. And two, crap, I've been part of the reason why migraine is, I'm a little biased, but perhaps the most frustrating condition in all of existence. Everybody says it's a headache. Nobody understands it. Everybody writes it off. And I realized, I was like, crap, I'm kind of part of the reason why these people are suffering so much. So it really hit home of like, okay, I've been part of a pretty serious problem for a really long time. I should probably be part of the solution now. And so that the sort of constellation of different things is this is super fascinating. And it's also a huge problem that doesn't really have great options outside of medication. And these people need help. They're truly suffering. If you've ever sat in front of someone who's having more than 20 migraines a month, it does not take you very long to realize, holy crap, these people are in rough shape and they just don't have any options. So through a combination of those things that I immediately knew, it's like, okay, I'm a migraine specialist now. One, because I just can't stop reading about it. I just think it's fascinating. And two, these people need help. They truly do need the most help. And that's been just such a joy in our professional life, is being able to see people through this process. And to answer the second part of your question, actually piggybacks off something that you have recently shared in our other podcast, is really starting with those foundational habits with migraine. Really big into just, people say 20 questions is super light work for us. We're asking 120 questions before we start giving suggestions. It's kind of the MO in our clinic, because we love to gather as much information as we can so that we know the first thing we're going to do is the most high leverage thing. So you start seeing results and relief quickly. And usually with migraine, it has to do with basic nutritional habits. So we do a lot of work with supplementation, just very basic, make sure all those bases are covered. Electrolyte supplementation, there's a whole bunch of genetic factors that make you predisposed to having really sort of excitable nervous tissue. So having electrolytes on board is an easy way to stabilize things. And nutrition. You can get so far. Eric, one of your patients, she's one of our testimonials, our greatest testimonial, arguably, is she was taking like all 9 of her Imitrex by the 11th day of the month. And all you did was stabilize her blood sugar with food and add some supplements. And she was having like 3 or 4?
Mm-hmm. Yeah. No, it's as wild as it sounds and as simple as it sounds, it's not always easy. And you kind of alluded to this in a conversation we were having last week as well. But I mean, the fundamentals will always be fundamental. And there's no way you can out supplement your way out of a poor diet. There's no way you can out supplement your way out of poor sleep habits. There's no exercise. There's no tablet in the world that will ever replicate what exercise does for us. And I think just your description of that right there for even migraine and how you approach that aspect is kind of an overarching view of just really how we do things in the office, right? So most of our patients know that when they're coming to us, one, they've seen so many other doctors before, and we just have to take a different clinical approach. And that's by looking at people in an integrative way, right? We're not against Western medicine. What we're really we're pro integration. And what we're looking at is we're trying to figure out what is going on structurally. How can we evaluate and elaborate and kind of assess you neurologically? And then is there anything metabolically that we need to look at? And it's a yes and conversation for so many discussions we have with whatever type of patient we're dealing with for the most part. But I really truly feel that not only separates us from a lot of other people, but I think the biggest thing that really separates our clinic from the rest is something that you just said, is like, we just really care. When I have a problem in front of me and there's a person in front of me who has this problem, like, I will go above and beyond the regular call of duty to try and figure out what's wrong with them. Like, we make referrals. We call other doctors to talk to them. Like, we have conversations outside the clinic that we don't charge for billable hours. Like, our goal is to genuinely get people better. And my patients know this. Like, my goal is to literally kick them out of my office in the most loving, caring way, when it's right, when it's appropriate. And that doesn't mean they can't ever come back to see us. It's just, I want them out there living their life. And I know you do as well too, Thompson. So is there anything that you would empower people to do or empower them to go after and take action on if they're stuck, if they're still looking for answers, or if they're still finding like the way to figure out how to like manage their symptoms?
Yeah, I would say if you've tried a lot, and if you're listening to this and you've had neurologic symptoms of concussion, dizzy, migraine, headaches, whatever it is, oftentimes you've probably had different pieces of the puzzle at some point. I think especially with migraines and concussion, it's pretty similar as well. As the predominant philosophy is, okay, this drug is going to work. And then if it doesn't, the next drug should be the thing. It should fix it for you. And then if that doesn't work, it's like, okay, well, we'll just tweak this. And you kind of you get pulled into this belief system. I don't think it's anyone's fault, but it's a belief system of the next thing. This one thing is going to be the ticket. It's going to be your end all be all. There's going to be one thing that's just going to do it for you. And if you're one of the lucky ones to get that golden ticket, fantastic, great, super happy for you. If that's not the case, then I would encourage you to break out of that mindset and adopt a mindset a little bit more of, okay, we're going to try this thing, and if it helps a little, great, add it to the toolbox. And then we're going to investigate this. That didn't work at all. Okay, I'm not going to go there again. And I'm going to try this. So the goal is really to accumulate a collection of habits and different modalities that work for you, that if done together over time can create more of a long-term permanent change. In general, some of the things that we see are the faster things work, the faster they will not work also. So some of these things just require a little bit of time. Some of these things require a little bit of equity built into your lifestyle in order for them to work. And so if something doesn't work right away, just give it some time, and we can be happy to help you figure out what collections of things over time is going to help. But that mindset, I think, is really harmful to a lot of people, because a lot of times they're doing the right things. They just aren't experiencing that immediate relief that they're hoping for. And that hope is sort of a false sense of a poor expectation that's been put on you by a larger system at play here. So that's one of the things that we see, that mindset, that shift in mindset rather, is really, really important. And once people really adopt that and start to embody it, that's when you see people go from 25, 30 migraines a month, and then 6 months later, they're having 3 or 4. We see that all the time, and it always starts with just a very small shift in mindset. So if you're out there and you're struggling and you're just gone from one thing to the next, sometimes it's just a little bit of help at a time, and eventually you look back and you're like, oh, I haven't had a migraine for 2 weeks. That's cool. So that would be my advice, at least for now. We have plenty of other gems like that in the future. What would yours be, Eric?
Yeah, I think for those who are still struggling, like we do so much with so many different conditions, right? So we've talked on with migraine and then headaches. Obviously, they're different conditions, but they're always lumped together similarly. But we do a ton of work with people who have concussions, traumatic brain injuries, dizziness, and vertigo. I mean, these are kind of just our bread and butter symptoms, we'll say, or conditions that we work with. But we work with so many other ones. I mean, we get peripheral neuropathies in the office. We get people with a ton of like interesting visual issues. The list kind of goes on. So, if you're struggling or you haven't found the solutions you're looking for, then, reach out to us for a free consultation. I mean, what do you got to lose? You literally can get 30 minutes of our time where we won't charge you. And it's an opportunity for you to ask questions, tell us your history, and then in the most, honest way possible, like we're going to tell you if we think we can help you. And if we can, great. Maybe we move on to an examination. If we don't think we can help you, then we're going to be honest with you and say, hey, we're not the right fit for you. We send patients away all the time because we don't think it's right for you to come in if you need to see 2 or 3 other doctors before us, or you need a different approach, or we just don't have the skill set to help you. I mean, it's just something that we believe in, and we built a reputation on that. So with all that said, I thank you for joining us. This is going to be one of many podcasts that we put out. We're excited to finally bring this to light. And once again, we are Dr. Reese and Dr. Mayasaka with the Neural Connection, and this is Rewired, a podcast put on by the Neural Connections. If you're somebody who wants to get some help and wants to find some solutions, reach out to us for a free consultation in the description below this YouTube video, and we hope to hear from you soon.